Some of the most common kids' foot problems are also the most ignored. This might surprise you, but as a podiatrist who specializes in children's foot health, I see more kids for skin and nail problems than almost any other issue. We're talking about ingrown toenails, plantar warts, athlete's foot, and excessive sweating, problems that most parents think are just part of growing up. The truth is, these issues are often dismissed because they seem minor compared to broken bones or serious injuries. Parents assume kids will grow out of them, or they'll try to treat them at home without really understanding what they're dealing with. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas. I've been working with children and their families for over 25 years. In my practice, I see kids of all ages dealing with these common but often misunderstood foot problems. What most parents don't realize is that these small issues can become big problems if not addressed properly. An ingrown toenail can become seriously infected. A plantar wart can spread and become painful. Athlete's foot can lead to secondary bacterial infections. But here's the good news. All these problems are very treatable when you know what you're dealing with. And even better, most of them are preventable with the right knowledge and habits. The key is understanding why these problems happen in children, recognizing the signs early, and knowing when home treatment is appropriate versus when you need professional help. In today's module, I'm going to walk you through the most common skin and nail problems that I see in children's feet, explain why kids are particularly susceptible to these issues, and give you practical strategies for both treatment and prevention. Before I get into it, please like, share, and subscribe to these videos. I also wrote a book all about children's foot health. You can get it for free at www.kidsfootbook.com. Let me start with ingrown toenails because this is probably the most common nail problem I see in children. An ingrown toenail occurs when the edge of the toenail grows into the surrounding skin instead of over it. This causes pain, redness, swelling, and if left untreated, can lead to serious infection. So why do kids get ingrown toenails? There are several reasons. The most common cause is actually genetics. You can inherit the way your toenails grow. Some people are born with nails that are simply too wide for their nail bed, or nails that naturally curve more than normal. If you had ingrown toenails as a child, there's a good chance your child might develop them too. Improper nail trimming is another major cause. Many parents cut their children's toenails too short around the corners, which encourages the nail to grow into the skin. The correct way to trim toenails is straight across, leaving the corners slightly longer. Tight shoes and cleats can also cause ingrown toenails. When shoes are too tight, they push the skin up against the nail, forcing the nail to grow into the skin. This is especially common in young athletes who wear tight cleats. Trauma to the toe, like stubbing it or dropping something on it, can also lead to ingrown toenails. Here's how you can recognize an ingrown toenail. There will be pain along the edge of the nail, usually the big toe. You'll see redness and swelling around the nail. The skin might feel warm to the touch, and in more advanced cases, you might see drainage or pus. Now, there are some things you can try at home for mild ingrown toenails. Soaking the foot in warm water with Epsom salts can help reduce swelling and pain. You can apply a topical antibiotic like Neosporin or Polysporin to prevent infection. But here's what you should never do. Don't do what I call bathroom surgery. Don't take nail clippers or scissors and try to dig out the ingrown portion. This almost always makes the problem worse and can lead to serious infection. If the ingrown toenail is severe, if there's pus or red streaking, or your child has diabetes or other health conditions that affects healing, you need to see a podiatrist right away. In my office, I have several ways to treat ingrown toenails for children. For mild cases, I often use a system called OniFix, which is completely painless composite that's applied to the nail to grow properly and pull away from the skin. For more severe cases, I might need to remove the ingrown portion of the nail. This is done under local anesthesia, and only the problematic edge is removed, never the entire nail. For recurrent ingrown toenails, there's permanent procedure that prevents the nail border from growing back. Now let's talk about plantar warts, which are another very common problem in children. Plantar warts are caused by the human papillomavirus, or HPV. This is the same family of viruses that cause other types of warts, but the strains that affect the feet are different from those that cause wart in the hands or other parts of the body. Children are particularly susceptible to plantar warts for several reasons. First, their immune system are still developing, so they're more vulnerable to viral infections. Second, the skin on children's feet is more hydrated and softer, which makes it easier for the virus to penetrate. The virus spreads through direct contact with contaminated surfaces. This is why kids often pick up plantar warts in locker rooms, public pools, and shower areas, and other places where people walk barefoot. Plantar warts can appear as a single lesion or in clusters called mosaic warts. They're usually painful when you squeeze them from the sides. They often have small black dots in the center. These are actually tiny blood vessels. Technically, plantar warts are self-limiting, which means they'll eventually go away on their own, even as the child's immune system learns to fight the virus. But in reality, they often become larger, spread to other areas, and become increasingly painful. There are many over-the-counter treatments for plantar warts, but honestly, they're usually not very effective. The skin on the bottom of the foot is thick, and most over-the-counter treatments are just not strong enough to penetrate effectively. In my office, we have several treatment options. Traditional treatments include topical acids, cryotherapy, which is freezing, and laser therapy. These treatments work by destroying the wart tissue, but they also affect the surrounding healthy skin, which can be painful and may leave scars. That's why I'm excited about a newer treatment we use called Swift microwave therapy. This is a completely different approach that uses low-dose microwave energy to expose the virus to the immune system, allowing your body to recognize and fight it naturally. Studies show that less than 1% of warts come back after Swift treatment, and it's much more comfortable than traditional treatments. Now let's discuss the athlete's foot, which is very common in children despite its name suggesting it only affects athletes. Athlete's foot is a fungal infection known medically as tinea pedis. The fungus that causes it is actually normal flora. It lives naturally on our skin and in our shoes. The problem occurs when conditions become favorable for the fungus to overgrow. The fungus thrives in moist, warm environments, which is exactly what you find inside children's shoes, especially athletic shoes. Athlete's foot typically presents as redness, flaking, peeling, or cracking of the skin. It's commonly found between the toes and the soles of the feet. It can be itchy and sometimes painful, especially when there's cracking. The condition is contagious and spreads easily in damp environments like locker rooms, pool decks, and even your own bathroom. For treatment, I recommend avoiding sprays which contain alcohol and can burn if there's any cracking. Instead, use antifungal creams which are more effective and less irritating. If over-the-counter creams don't work after a few weeks of consistent use, it's time to see a podiatrist. We can prescribe stronger topical treatments or in some cases, oral antifungal medication. Prevention is really the key to athlete's foot. Keep the feet clean and dry, especially between the toes. Wear moisture-wicking socks instead of cotton socks. Protect feet in public areas by wearing flip-flops in locker rooms and around pools. And make sure shoes have time to dry out between wearings. Let me also address excessive sweating and foot odor, which can be embarrassing for children and teenagers. Some children naturally sweat more than others, a condition called hyperhidrosis. This excessive moisture creates an ideal environment for bacteria and fungus to grow, leading to odor and other problems. The key to managing this is moisture control. Use moisture-wicking socks and breathable shoes. Considering using foot powders and antiperspirants designed for feet, and make sure to rotate shoes so they have time to dry completely. I also want to briefly mention toenail fungus, which is less common in children than adults, but can occur, especially after trauma to the nail. Sometimes it looks like toenail fungus is actually just trauma to the nail from tight shoes or injury. That's why proper diagnosis is important before starting treatment. Now, when should you bring your child to see a podiatrist for these issues? For ingrown toenails, seek professional help if there's significant pain, signs of infection like pus or red streaking, or if home treatment isn't working after a few days. For plantar warts, consider professional treatment if the warts are painful, spreading, or interfering with activities. Don't wait for them to be a major problem. For athlete's foot, see a podiatrist if over-the-counter treatments aren't working after consistent use for several weeks, or if the condition keeps coming back. For any foot problem, seek immediate care if your child has diabetes or other conditions that affect healing and immune function. Here's something important for parents to understand. Children's feet change rapidly as they grow. What might seem like a minor problem can quickly become more significant if not properly addressed. Early treatment is almost always easier and more effective than waiting until problems become severe. Also, don't underestimate the impact these problems can have on your child's quality of life. An ingrown toenail may seem minor to you, but it can be very painful for your child and affect their ability to participate in activities they enjoy. Let me give you some practical prevention tips that can help avoid many of these problems. For nail problems, trim the nails straight across and not too short. Make sure shoes fit properly with adequate room in the toe box. Teach children not to pick at their nails or cuticles. For skin problems, emphasize good foot hygiene. Teach children to wash their feet daily and dry them thoroughly, especially between the toes. Use moisture-wicking socks and breathable shoes. Protect feet in public areas. And for all foot problems, pay attention to your child's complaints. Children aren't always good at expressing pain or discomfort, but when they do complain about their feet, take it seriously. Remember, these common foot problems are very treatable, but require proper diagnosis and appropriate treatment. Don't assume your child will just grow out of them or that home remedies will always be sufficient. The good news is that with proper care and treatment, these problems can be resolved quickly and effectively, allowing your child to get back to being active and comfortable. Thanks for taking the time to watch this module. Please take a moment to like, comment, subscribe, and share on social media to help other parents find this information. Don't forget to pick up my free book about children's foot health at www.kidsfootbook.com. The link is at the top of the description below. If your child is dealing with any of the foot problems we discussed today, ingrown toenails, warts, athlete's foot, or persistent odor, don't hesitate to reach out. These issues are more common than you might think, and they're very treatable when properly addressed. The link to request an appointment is also in the description. Thanks so much for watching, and have a great day.